Hello, my name is Becca Rusk, and today I will be talking about Meige's syndrome. Meige's syndrome is a rare idiopathic neurological disease characterized by repetitive eye blinking and abnormal facial movement. It is a type of focal dystonia. Dystonia is characterized by abnormal involuntary movements. Meige's disease is a combination of blepharospasm, which is involuntary eye blinking, and oromandibular dystonia, which is involuntary movement of the jaw, tongue, and mouth. It is often misdiagnosed as either only blepharospasm or oromandibular dystonia, or it may be misdiagnosed as a purely psychiatric condition such as conversion hysteria or tardive dyskinesia, both of which have involuntary movements. Meige's disease is also known by other names, as you can see here. It typically occurs in individuals over 40 years of age, and women are twice as likely to contract this disease than men. The diagnosis is made on the basis of external signs. No specialized tests or examination to confirm this diagnosis exists. The presenting signs and symptoms are, as we talked about before, blepharospasm, which is the involuntary contraction of the orbicularis oculi muscles, which will cause closing of the eyes. This can happen anywhere from a few seconds to 20 minutes, rendering the individual functionally blind. Oromandibular dystonia are involuntary and typically forceful contractions that can affect a variety of the muscles of the jaw and tongue. These symptoms may fluctuate considerably from day to day and can be aggravated by stress, fatigue, or certain actions. The actions that aggravate the symptoms are known as action dystonia. Laryngeal, pharyngeal, and neck muscles can be progressively involved. The symptoms typically improve with sedation and may disappear completely during sleep. The two ladies here are showing signs and symptoms of Meige's disease. The woman on the left has both involuntary eye closure and closure of the mouth, and the woman on the right has an involuntary opening of the mouth. Both are very typical of individuals with Meige's syndrome. The exact etiology of this is unknown. However, lesions have been found in the basal ganglia, diencephalon, and upper brainstem. It has also been proposed that there is an abnormality in basal ganglia functioning that may be due to the body's inability to process neurotransmitters. Another theory is that there is hyperactivity of dopamine and acetylcholine that is causing the disease. It can be induced by neuroleptic drugs such as those used to treat Parkinson's disease. Speech impairment varies from individual to individual depending on the primary muscle groups affected. An individual will present with adductor spasmodic dysphonia, which will result in voice stoppages. The most significantly impacted subsystems of speech are phonation, articulation, and prosody. From most severe to least severe are imprecise consonants, vocal harshness, distorted vowels, irregulatory articulatory breakdowns, slow speaking rate, strained strangled voice, voice stoppages, short phrases, and excessive loudness. As you can see here, each is broken up into its subsystem. Resonance and respiration are the least affected. Respiration may only be affected if the involuntary contractions affect the muscles of respiration. Resonance may result in mild hypernasality, but beyond that, it is typically unaffected. And as you can see, we already talked about the articulation, prosody, and phonation characteristics in the last slide. Potential impairments that go along with this are dystonia that is present in the extremities, trunk, and neck. There can be ocular problems such as eye infection, trauma, functional blindness, and dry eye, dental problems such as TMJ syndrome and jaw malocclusion, hyperkinetic dysarthria, difficulty swallowing, and this disease has been associated with other autoimmune disorders, thyroid disease, a variety of psychiatric disorders, including depression, anxiety, OCD, and stress. Although there is no treatment for Meige's disease, drug therapy can be helpful in about a third of patients. These medications may have to be combined with other medications in order to find the best treatment possible. However, this process is often long, taking typically a year to find the correct combination that best alleviates symptoms. If medication does not work, individuals can get injections of botulinum toxins, also known as Botox. The results depend on the accurate targeting of the affected muscles and the appropriate amount of toxin used. However, a patient may need to see several different doctors in the specialty of where their spasm is occurring in order to get relief from Botox. Botox is effective in approximately 50% of patients. A more severe treatment strategy is deep brain stimulation. This is where electrodes are placed in the internal segment of the globus pallidus. This can be bilaterally or unilaterally. However, more success has been shown when they are bilaterally implanted. These benefits typically develop gradually over several months. However, there are some risks. Risks include stroke, infection, development of new neurological signs, including visual field deficits, or mild worsening of motor functioning. In a study performed by Bloomstead et al. In 2008, a 41-year-old male with severe right arm tremor, as well as the other symptoms of Meige's, presented with Meige's syndrome. Treatment was initially with Botox, and although this was successful, his condition deteriorated. His eyelid closure was present greater than 50% of the time. On the upper left-hand corner, right here, this is the man's drawing following the line before implantation. 1.5 years after deep brain stimulation, the patient drew the lines again with a significant improvement. The patient was able to drive a car and see after 1.5 years of this therapy. In another case study performed by Markaki and colleagues in 2010, a 49-year-old woman who was functionally blind, as you can see on the left prior to the DBS, she had to quit her job because she was unable to see. She became socially isolated and lost interest in all activity as a result of Meige's syndrome. Following DBS, on the right-hand side, as you can see here, her symptoms have almost completely disappeared. Other treatment strategies can include sensory tricks, such as biting a toothpick, touching the face, or other actions performed in order to alleviate symptoms. However, these do not work all the time. Dental prosthesis or bite blocks can help stabilize the jaw, and psychiatric therapies such as hypnosis, psychotherapy, desensitization, sedatives, and antidepressants have had little impact on the dystonia itself, but may benefit the patient in reducing anxiety. Speech therapy can be used for patients, and the SLP can teach easy onset of phonation for involuntary laryngeal movements. Here is some education and resources for individuals or their family members that may have Meige's syndrome. These are my references for the PowerPoint, and thank you.